She walks through the streets of Nigeria with a megaphone during polio campaigns, using her powerful voice, urging everyone to vaccinate their children. She is impactful. She walks alone in Nepal, 8 miles each way to visit communities that are unreachable by car, carrying her supplies through heat, rain, and often on uneven ground. She is strong. She enters homes in a local village in India to provide education and administer vaccines. She encounters fear, kindness, anger, and sadness. She is resilient. She sees patients in Peru, often alone in rooms with closed doors, choosing her words carefully to adapt to whoever walks through those doors. She is strategic, impactful, strong, resilient, strategic, but also human, vulnerable. Healthcare workers are the heart of every successful public health initiative. Throughout COVID, they sacrificed their mental and physical health, working tirelessly to save lives. Globally, women make up 70% of the health workforce and about 90% of frontline healthcare workers. 90%. Because it's hard to count volunteer or incentive-based workers, we don't know the exact number, but that's somewhere between 53 million and 1.8 billion women working on the front lines of public health around the world. We have so much to thank them for, and yet very little is being done to keep them safe. I'm Sara Clements. I'm a health scientist, and I lead a team of incredible humans at the Centers for Disease Control and Prevention to support and strengthen the immunization workforce in low and middle income countries. For my leadership project, my team is putting the safety of women at the forefront of our work. And I want to be clear, I'm not talking about safety that comes from having the right equipment or supplies. We are focusing on safety from perpetrators, from other humans. We know that 59 countries do not have laws prohibiting sexual harassment in the workplace. 110 don't have criminal penalties. Women are 4 times more likely than men to encounter sexual harassment. And a recent survey of humanitarian workers found that 86% know of at least one aid worker who is a survivor of sexual violence in the workplace. Yet, of the 92 organizations that they surveyed, only 15 actually train their workplace on sexual exploitation and abuse. We also have countless stories of harassment, assault, rape, and even murder among women working at the most local levels. I honestly can't remember what topic I started with for my leadership project, but with every conversation, every article I read, and every time I tried to find data to back up what I intuitively knew to be true, it became abundantly clear that safety of women in the workplace is a tremendous blind spot for global health. Imagine the impact on health systems around the world if 90% of our frontline workforce felt safe and motivated to do their jobs. I did. And sharing that vision with others has led to funding support from Gavi to pilot a new approach to workforce development, putting women at its center in 1 or 2 countries this year. We will work through a trusted local partner on the ground to collect qualitative and quantitative data to understand the extent of the problem and the local context. We will use this data to hold human-centered design workshops to co-create solutions directly with the women who are affected. Collectively, we will decide where to start and begin piloting and evaluating interventions with continuous feedback from the healthcare workers. And we will communicate. We will advocate. We will share broadly through multiple channels, partners, and forums to ensure this problem is no longer invisible. While there's still so much to do, the key pieces are in place. Funds, country interest, and passionate humans like all of you to keep it going. This momentum is powerful, and I'm certain it will only grow over time. WomenLift has ignited the flame in me that had been flickering for years. I've found my voice, and more importantly, I've learned how to use it strategically so that it will be heard. I've also found allies and encouraged them to use their voices, creating a movement around us. And I've identified what is most important to me as a leader, to lead with authenticity and vulnerability, and to create brave spaces where others can do the same. Most importantly, I found a group of women that will stand by me, encourage me to keep speaking up, and use their voices to support me on the days that it all feels like too much. And I will do the same for them. So, as the unofficial DJ for the 2023 WomenLift cohort, it feels right to quote Alicia Keys and Brandi Carlile from their song, A Beautiful Noise. I have a voice. It started out as a whisper and turned into a scream. It made a beautiful noise, shoulder to shoulder marching in the street. When you're all alone, it's a quiet breeze, but when you band together, it's a choir of thunder and rain. Now we have a choice because I have a voice. So the next time she walks with her megaphone, the leaders of that community have already publicized the penalties for harassment or harm of healthcare workers. The next time someone in the health clinic makes a comment about how pretty she is and puts his hands on her shoulders, she can have him removed without fear of retaliation or stigma. The next time she enters a home, she has a trusted colleague waiting for her outside. And the next time she walks 8 miles, she has an app on her phone to send an SOS to others in the area if she feels unsafe. Impactful, strong, resilient, strategic, and safe. Because a safe and supported workplace for her means a healthier world for us all. Thank you so much.